Mental health overtakes cancer and obesity as Britain's biggest health worry. I'm going to read into this more from The Guardian, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an article from The Guardian with the headline that mental health overtakes cancer and obesity as Britain's biggest health worry. An Ipsos survey asked people in 31 countries what they thought about their health and their healthcare. Guys, while you're here, make sure you hit the like button and share us across social media so others are notified of this video. Now, before I discuss this, I just want to show you guys. So a couple of days ago, I decided I did see this this story. Obviously, this was a couple of days ago, so I decided to test it with people on my channel, and I wanted to ask, what do people consider the biggest health issue in the UK? And it's interesting now. Yes, of course, it's not. It's, again, like I say, with all polls, they're taken with a pinch of salt. But at the time of this recording, there's 163 people who have cast their votes on this. And you can see there 42% of people claim it is mental health. 32% think it's cancer. 16% say it's others. 4% think it's COVID. 6% saying alcohol. Some of the comments are more serious than others there. Like people claiming Labour is a health issue, which is a nonsense one. But some of them are very, very silly comments there. But some of them are much more common. Someone said privatisation. Again, we're talking about health, not actual policies here. Weber Scott, cancer, mental health, alcohol in that order. Considers cancer to be one of a big issue. I do agree. Cancer is a definitely one there, but a lot of them they're not really taking it seriously. But there are some there who are being a little bit more. I know some people don't always take the polls seriously, but I like to do polls every now and then to see what people think and feel. Rachel M saying alcohol is the biggest contributing factor in many health conditions, including cancer and mental health above. Great point there, I think, by Rachel there. Ignorance and the Tories there. So just a couple of comments there from the polling on that there, but it is interesting to see that that the majority, and it may not even be subscribers, it can actually just be people who happen to come across that polling and just making their prediction as well. But it is interesting that mental health has definitely become something of a bigger issue. I think it's fair to say that if you were to ask people 10, 20 years ago, would they consider mental health to be the biggest health issues in the UK, I probably would have said no. I think most people would say. Probably people would say cancer has always been a massive health issue. And it is one of the biggest challenges because it is so hard to overcome. And for some, it's just it's a battle that they cannot win as well. It is, and this along many other things. Interesting that alcohol is definitely one there as well. And I'm sure there are many more down in the comments below as we talk about this. Considering it. Now, I've said many times about how I feel about mental health. For me, it's a very personal one for me because I have been affected by mental health. I still do suffer from mental health every now and then. I don't always show it, but I think it's it is a big issue because it can literally stifle your life. It can stifle your journey. Cancer can kill you. It can break your body down. It can slow you down. It can make you down a terrible path. There are many, many health worries in the world. But I think this Ipsos survey, like I say, with any surveys, always take them with a pinch of salt. It is interesting that that people do consider mental health to be the biggest health worry. So let's read more into this, you guys. So mental health is overtaking cancer and obesity as the health problem most Britons worry about, a global survey has revealed. So experts said the shift in the public's perception reflected the sharp rise in recent years in mental ill health caused by the COVID pandemic, the cost of living crisis, and male violence against women. Very good spot pointing out there. Yes, obviously when we were during the pandemic, being locked in your homes and everything, it's not good for your mental health. Obviously, the mental health side of the cost of living crisis, not being able to pay your bills, not being able, if you're going to be able to get past the next very day, that can lead to stress, anxiety, and of course that can lead down to the path of mental health, depression, and whatnot as well. And of course, male violence against women. Many women out there have been terribly mistreated and worse, and that can leave a scar on the women for the rest of their lives. and that can lead obviously down to same things of depression, anxiety, all those emotions and feelings as well. So all those things are tied into male violence against women as well. Some women more stronger than others to overcome it. The trend is revealed in a survey what the public in 31 countries worldwide thinks about health and the healthcare they receive, undertaken by pollsters Ipsos. Study began in 2018. Exactly the same proportion of British participants, 50%, identified cancer, obesity and mental health as among the biggest health problems facing the country. But mental health has moved up the rankings to become the illness that is the most number of people, 54% in England, Scotland and Wales, now say it is a worry. In comparison, obesity was only mentioned this year's edition of the research by 36%, while cancer was also cited the slightest fewer than before, 49%, even though record numbers were being diagnosed. Opinion globally has had even more dramatic increases in the priority people given to mental well-being. In 2018, 27% of people in the 31 countries said it was pressing health concern, but now 45% do so, and more than other illnesses. I also think as well, because of the power of social media and the internet, has opened people's minds up to realizing that they do have a mental health issue as well. I do think that does play a contributing factor to it as well, whether people being more aware about mental health than before. I think it's fair to say that there was perhaps how mental health was always an issue, but people being more aware of it, I think, was something that wasn't enough about. And I think it's much easier to make people aware of it through the power of social media and the internet. Over the same time, though, the proportion of people mentioning cancer worldwide has fallen noticeably from 52 to 38, while the number of citing obesity is also down from 36% to 22%. So cancer concerns have fallen despite a global rise in the number of people getting the disease, which is linked to aging populations and to lifestyle factors such as bad diet, smoking and alcohol intake. Yeah, so this is smoking, alcohol, and not looking after your diet. All these things can, there's many things that can contribute for you to getting cancer. There's even the horrible take of, obviously, it can be passed on from generation to generation, cancer as well, within certain people's DNA as well. There has been that theory as well out there. It's probably, I don't know how people much more smarter than me would know that, but there has been that fundamental as well, and not just a case of smoking and drinking as well. There are all sorts of things that can lead you to getting cancer. So it's a really tough one for a lot of people. The trend represents a fundamental shift in attitudes to mental health compared to 2018. Perhaps the pandemic's biggest long-term effect on public health will be on mental health, Ipsos has said. The picture that emerged from its findings of a global population increasingly anxiety about mental health is understood to be a rise in those who see stress as a big health problem. The proportion citing it has risen from 12% to 17% in Britain and from 25% to 31% globally. Here in the UK, we're seeing growing recognition of mental health as a major concern, with 54% of Britons now saying it is a pressing health issue facing the country. So Simon Atkinson, Ipsos Chief Knowledge Officer, globally the pandemic is still casting a long shadow, he added. Ipsos interviewed 23,667 people in 31 countries, including the US, Malaysia and India, in July and August. That includes a representative section of 1,000 Brits. Andy Bell, the chief executive of the Centre for Mental Health think tank, said the greater anxiety about well-being was not surprised because the nation's mental health has been deteriorating over the last decade, with rates of mental ill health and referrals to mental health services rising. More than 1 million people in England are on the waiting list for the NHS mental health care. That's incredibly concerning. Women are more likely than men to see mental health as a significant worry. Both in Britain and globally, Ipsos found worldwide 55% of women mention it, but only 40% of men. Similarly, younger people referenced it more than older generations, who are more likely to cite cancer. Women have higher rates of mental ill health than men, and women are more likely than men to be living in poverty, and male violence heightens too many women's risk of mental health difficulties, Bell added. Cancer sharp fall in public priority globally is a surprise, but that many may reflect confidence that survival in many forms of the disease is increasing, and that new treatments are emerging, such as immunotherapy, surgical advances, and more precise types of radiotherapy. Yeah, there have been much more, as time passes, there have been new and initiative ways to combat cancer now as well. Nasir Tolby, Cancer Research UK Director of Evidence and Implementation, said, thanks to decades of research into diagnosis and treatment, cancer survival in the UK has doubled to over the last 50 years. But with cancer affecting nearly 1 in 2 of us in our lifetimes, it remains a defining health issue and a key concern for people across the UK. Now, I 100% agree with that. I 100% agree that cancer is something that is still a major issue, both UK and globally, and I think everyone accepts that. I don't think anyone is, by any way, shape, or form, dismissing the importance of dealing with cancer. I think everyone completely and fully accepts that. But I think people have become more and more aware of their mental health, and people have become more and more affected of mental health. Now, before I wrap up, I just want to point this out here as somebody I do have certain means that I try to use to help me combat my mental health, and I want to share some of them with you guys if I can, especially if you are somebody who suffers quite a lot from mental health yourself. If you can, take walks. If you can, distract yourself. If you can, don't think too much about a certain negative issue that can bring you down. Try always to deflect. Try to keep yourself busy. One thing that can really affect your mental health, and this is something that's affected me, is simply spending too much time on social media. Don't spend too much time scrolling on TikTok or Twitter or whatever, because they can sometimes lead to negativity. Even if it's your job, even if it's something that you need to do, limit yourself how much time you spend on social media. Control that. Like literally, find ways to control that. There are many things that you can do to combat mental health. Even without the need of ever having to pick up the phone call and speak to a doctor. It differs to everyone. For me personally, I always try to distract myself. I always try to try to distract myself with things. Try to keep myself busy. Always try to look at a task or something that needs to be done. There's a reason why I'm very passionate about professional wrestling, because I like watching wrestling and all that kind of stuff. It's something that distracts me from work and everything, and it's a good distraction. For some people, it might be football, might be music. There's all sorts of different distractions that you have, because especially when we live in a very negative world, you're surrounded by negativity all the time. It can really bring you down. So always look for alternative means, or look for ways. There are also plenty of websites out there that can help you and affect your mental health that does not cost you anything to look at as well, such as Mind. If you're ever feeling worse than that, obviously do check out the Samaritans as well in the UK. Obviously, if wherever you are, where you are, simply just go on the Google and just type mental health, and you'll find an organization or something out there that can help you. It's not always a case of you need to pay to get help. Sometimes you can get help and it won't cost you anything to do so, guys. It really is. It may seem a big obstacle, but it's only a big obstacle if you make it a big obstacle for yourself, and it's just about overcoming that obstacle there. So I hope some of that helps you. But do check out my mental health playlist if you want to read some of the stories on there. If you want to hear some of my shared experiences of mental health, you can check out my very first live stream that I covered about some of the issues that I went through as well. But feel free to check out any websites and whatnot that can help you if you are suffering from mental health. But what do you guys think? What do you guys make of mental health being overtaking cancer and obesity as Britain's biggest health worry? Are you surprised by that? Are you surprised by that? Do you think it should still be should be cancer? Should it be something else? Or is it a case of it doesn't really matter what is the biggest one? They're all issues and they all need to be resolved in one way, shape or form. Let me know your thoughts and more down in the comment section below. If you found this video informative or helpful to you, please hit the like button. We greatly appreciate it. Please share this across social media so others are notified of this video. If you haven't subscribed already, please consider subscribing, because it really does help support the channel. If you want to go one step further, financially support me in the work that I do here, you can do so by becoming a YouTube member for just 99p, or you can join me on Rumble or Patreon for exclusive content on those platforms as well. Thank you all so much for watching, and I hope to catch you all very, very soon.